Hi guys, welcome to Nursing Update channel. So you guys are enjoying the videos. So today we'll see our second set of MCQs in obstetric and gynecology. Okay, so if you are new to our channel, please subscribe our channel and press the bell icon. This week is full of MCQs related to obstetric and gynecology. Okay, let's move on to our today's video. Okay, first MCQ is body temperature in newborn is mainly regulated by brown adipose tissue, shivering, sweating, warmth seeking behavior. So this is one of the easiest question I ever seen. So the answer is brown adipose tissue. Okay. So in obstetric and gynecology, newborn is one of the most important topic. Okay. So from newborn, you can expect 100% a question from newborn. Okay. They may ask question related to ABGA score. They may ask resuscitation, or they may ask from immunization. Okay. So like that, many aspects are there in newborn. So a Pakka 100% sure one question will surely come from newborn. Please be sure that you read newborn very carefully, because you may get minimum 2 to 3 questions from newborn. Okay, so let's move on to the second MCQ. The distance between the lower border of symphysis pubis to sacral promontory is. Okay, so option A diagonal conjugate, option B obstetric conjugate, option C transverse conjugate, option D biparietal diameter. Okay, in obstetrics there are some measurement like biparietal diameter, bitemporal diameter. Okay, diagonal conjugate, obstetric conjugate, like that. So you should know what is biparietal means, what is bitemporal diameter, what is obstetric conjugate, what is diagonal conjugate, and you should know what is the measurement value. You should know how much is diagonal conjugate, how much is obstetric conjugate, how much is biparietal diameter. This biparietal diameter one of the most frequent MCQ, and this MCQ also came. Okay, so coming back to this question, the distance between the lower border of symphysis pubis to sacral promontory is. The answer is diagonal conjugate. Okay, so you should know, right? So see this diagram. That projection is there, that is sacral promontory, and this is the symphysis pubis. Okay, see the red line. Red line where it is coming from the sacral promontory to the mid of the symphysis pubis, or inside inlet of the symphysis pubis. That is known as obstetric conjugate. Okay, so another conjugate they have given from sacral promontory to the lower border of the symphysis pubis. Okay, what was the question? The distance between the lower border of symphysis pubis to sacral promontory is. Okay, diagonal conjugate. So you should know the value also. Okay, so diagonal conjugate is 13.5 centimeter, and obstetric conjugate is 11.5 centimeter. Okay, this is also asked. What is the length of obstetric conjugate? This red line is 11.5, and diagonal conjugate will be 2 centimeter more than that, that is 13.5. Clear? Okay, so we'll move on to the next MCQ. Next MCQ, a woman who has given birth more than 5 times is known as. Okay, this is terminology. Option A multipara, option B nullipara, option C grand multipara, and option D primipara. Okay, so you should know what is parity. Okay, so what is multipara? Multipara means the woman who has given birth to 2 or more times. Okay, what is nullipara? A woman who has not given birth, okay, to a viable child. What is grand multipara? A woman who has given birth more than 5 times. That is grand multipara. And what is primipara? The woman who is giving birth for the first time. Okay, so I have given all the definitions, and the answer for this question is grand multipara. Okay, so multipara means more than 2 times, grand multipara means more than 5 times. For first time the woman is giving birth, that is primipara. If she didn't give birth for any of the viable cells, that is known as nullipara. Okay, let's move on to the next MCQ. The entire transitional phase between puberty to menopause is known as option A menarche, option B menopause, option C puberty, option D climacteric. Okay, so what is this question means? A woman's reproductive cycle is known as climacteric. Okay, this is new terminology and this question has already came in exam. I don't know which exam, but I have already explained you whatever MCQ we are discussing today or we are going to discuss this week or already came in exams in 2019 and 2020. Okay, so this climacteric means the transitional phase between puberty means first menstrual cycle to menopause, last menstrual cycle. Okay, so I already told menstrual cycle related MCQs will surely come. Okay, let's move on to the next MCQ. The phenomenon of metal skimmer syndrome indicates option A fertilization, option B ovulation, option C conception, and option D implantation. Okay, what does this mean? Means a syndrome is the terminology is the metal skimmer syndrome. What does it mean? It means ovulation. Okay, for example, I have already explained what is ovulation in my previous video. If you didn't watch, I will share the link in my description also, or else you can search in our channel also the OBG part 1 MCQs. You can see what is ovulation. I have explained that ovulation process is known as metal skimmer syndrome. Okay, remember this metal skimmer syndrome, that is means ovulation. Okay, so next MCQ, the developing offspring until 8 weeks after implantation is known as option A zygote, option B morula, option C blastocyst, option D fetus, and option D embryo. Okay, so I have given a lot of options, means 5 options are given. So what they ask, after fertilization for first 8 weeks, that product of conception is known as what? The answer is embryo. Okay, so let us see what are the other terminologies. Okay, so what is zygote? The egg is formed, right? Both egg and sperm meet together and they got conception. Okay, that product of fertilization at 0 level means that 0 hour is known as zygote. From 1 to 4 days, it is known as morula stage. From 5th day onwards, it is known as blastocyst stage. Okay, so this is to the egg. Coming to the fetal development, 0 to 2 weeks, it is known as ovulatory period. 3 to 8 weeks, it is known as embryonic period. From 9 weeks to till birth only, you can tell that product of conception as fetus. Okay, so for first 2 weeks, it is known as ovulatory period. For 3rd to 8th week, it is known as embryonic period. Okay, so from 9th week onwards, it is known as fetus. So what was the question? The question was till 8th week after implantation, what it's known as? Answer is embryo. Already told. 3 to 8 weeks, it is known as embryonic period. Okay, I have given all the definitions for the options. What is zygote? After fertilization, immediately that stage is known as zygote. What is morula? For 1 to 4 days, that is known as morula. What is blastocyst? From 5th day onwards, it is known as blastocyst. What is fetus? From 9 weeks to till birth, it is known as fetus. And what is embryo? From 3 to 8 weeks, that is known as embryo. Okay, from first 0 to 2 weeks, it is known as ovulatory period. So So it will be little bit confusing, but you should remember. Okay, 0 to 2 ova, 3 to 8 embryo, after 8 fetus. Okay, what is zygote? 0 hours, 1 to 4 days morula, 5th day onwards it is known as blastocyst. So be clear with this term. Okay, this may ask in any of the exams. Okay, they may ask what is embryo, what is fetus, or they will give the definition and they will ask the what is means that product of conception at 10 weeks is known as, like that also the MCQs are came. Okay, that's all about today's video. If you like our video, okay, so subscribe our channel, press the bell icon, like our video and share our video to your friends or whoever is on preparation for competitive exams. Thank you so much, guys.